Dr. Kumar, you said that more recent data appear to be good, but we have to watch and wait about the trends in childhood obesity. Can you explain that a little bit more?
Yes, so there has been some recent evidence that prevalence of obesity in preschool children in the ages 2 to 5 years has gone down, and this is data coming from several centers in the country, several areas in the country. So I think it's encouraging to note that obesity in preschool children is going down, but I think we need more data to see that this is a consistent trend. Yeah.
And how many data points are there? I mean, the numbers are from what years?
2008 to 2012, so
okay.
Not too many years. Yeah.
Okay. And is there a general explanation? Are people paying more attention to exercise, or do we know yet?
I think the reason we feel this is the case is because probably one, parents are becoming more aware of what to offer to their infants and toddlers. Number two, the child care centers are more aware of what healthy foods are, and they are improving the kinds of foods that are being given to the children. So I think it's a combination of parents being more aware and the child care centers contributing as well.
Okay. And the actual classification of obese for kids is different than it is for adults.
That
Can
is
you just
correct.
explain that basic difference?
Yes, so the definition for obesity in children is determined by how the child compares to children of their gender and age. So we calculate what's called percentile for age and gender. So in children, a child is considered as overweight if their body mass index percentile is between the 85th and the 94th percentile. And they're considered obese if their body mass index percentile is at or above the 95th percentile. So it is age and gender specific.
Okay.
So the cutoffs change with age.
And the actual use of the term obese among the medical community when it comes to children, is that new? Were they not using that term obese before?
That is correct. Prior to 2007, pediatricians were encouraged by the Center for Disease Control to not use the word obese because of the negative meanings it has. But now, having recognized how obesity is affecting children, we are now making a diagnosis of obesity if the patient's body mass index is at above the 95th percentile. Having said that, I think when it comes to communication with the families, it might be best not to use that word obese and use more of the excess weight when talking.
Okay.
Yeah.
And in terms of the medical complications from obesity in children, you said that because of obesity, our children are aging. Why is that?
That's because obesity in children is associated with a lot of complications that until now were thought of, felt to be in adults. So the things I'm talking about are like diabetes, type 2 diabetes that used to be called adult onset diabetes. We're seeing that in obese children, high blood pressure, abnormal cholesterol levels. So all these things were initially seen with aging, and I feel that obesity is now making our children develop diseases that were typically adult diseases to begin with. So pediatricians are now seeing diseases, and that's why we think our children are aging.
Okay, I think that's all I need.
Okay,
Thank you very much.
Thank you.